Hi, my name is Gabby, and I am the nurse who works at the Penn FTD Center. Many of you have spoken with me over the phone to review your loved one's lab results, medications, or new symptoms they may be experiencing. Today, I am going to review caregiver strategies for symptom management. I will identify symptoms associated with frontotemporal degeneration, or FTD. I will discuss non-medication-based ways to manage these symptoms and help you determine when further support is needed. Symptoms in FTD can include behavioral changes, language deficits, changes to thinking, and movement difficulties. Today, I am going to focus on behavioral symptoms. If your loved one has a form of FTD, they may experience one or more of these different behaviors. The first is disinhibition, or the loss or lack of restraint based on social norms, leading to inappropriate behavior and impulsivity. This could look like making rude or uncharacteristic offensive comments, ignoring other people's personal space, shoplifting, reckless spending, touching strangers inappropriately, or aggressive outbursts. Those with FTD can also have apathy or indifference or lack of interest in previously meaningful tasks. Perhaps your loved one has lost interest in their work, hobbies, or relationships. They may neglect personal hygiene or have a loss of initiative. There may be emotional blunting or the loss of warmth, empathy, or concern with others. A common symptom of FTD is compulsive or ritualistic behaviors, and these are single behaviors or routines that are performed over and over. A few examples include repeating words or phrases, rubbing hands together incessantly, hoarding, rereading the same book over and over, or walking at the same place at the same time each day. We can also see changes in eating habits or diet. Perhaps your loved one is now binge eating carbohydrates or sweets, or only eating specific foods. Perhaps they're excessively drinking water or alcohol, or attempting to eat inedible objects. Those with FTD also have deficits in executive functioning, meaning they have poor decision-making, judgment, problem-solving, and organizational skills. Everyday tasks are becoming more challenging, especially those that require multiple steps, like cooking or doing the laundry. Your loved one may have agitation or emotional instability, meaning that they have frequent or abrupt mood changes. And lastly, they may have a lack of insight. They may fail to recognize changes in their behavior and lack awareness of the effect their behavior has on others. Before I continue, I want to emphasize that the changes to your loved one's behavior, personality, the way they speak and act are due to the disease. FTD patients simply don't have the cognitive resources to act the way they used to. It's not that they are being willingly difficult, it's that they are sick. Many of these symptoms, which appear to be directed at caregivers, are in fact a symptom of the person with FTD feeling anxious, confused, or over or understimulated. Today, I am going to focus on managing and preventing agitation and aggressive behaviors. Given the current circumstances in light of COVID-19 and limited options for outside resources or activities, agitation and aggressive behaviors can become more apparent. It is important to follow these 3 steps to best manage these behaviors. The first is careful assessment, second, creative problem solving, and third, addressing underlying causes of your loved one's behavior. The first is careful assessment. What behavior is occurring, and what does that behavior look like? Think about the behaviors I described a few slides ago. Is your loved one's action matching any of those? Do their behaviors sound familiar to disinhibition or mood changes, or perhaps compulsive or ritualistic behaviors? It's also important to identify what triggered this behavior. Keep track of the time, either the time of day or maybe what happened right before they got agitated or upset. Creating notes that track the timing and frequency of events can be helpful. Below is an example of a behavior log. So here you can see that the patient started getting agitated with their spouse roughly around 4 p.m. each day. And when looking at triggers, it was seen that the behavior seemed to be offset by the change of caregivers. The home health aide left for the day and the spouse came home. This information can be helpful when determining interventions, whether in the form of intervening with a non-medication-based strategy, or timings can be helpful to determine when best to give medication. Sometimes agitation can occur for no reason at all, but sometimes those with FTD can be triggered by certain things, such as long waiting periods, loud noises, too much stimulation, people getting too close to them, personal care, such as bathing, showering, dressing. Commonly, changes in environment, such as travel, a new home, or the presence of house guests, can create agitation because your loved one with FTD is no longer in their day-to-day routine. Something has changed. Perhaps this is a misperceived threat or fear and fatigue resulting from trying to make sense out of a confusing world. Things that used to be easy for your loved one are now proving more difficult because they don't understand, and that can be very frustrating and lead to angry outbursts. Here's an example of how to creative problem solve a situation where a person with FTD has aggressive behaviors. So a resident with behavioral variant frontotemporal dementia, or BVFTD, in an assisted living apartment pushed anyone in his way when walking to the dining room. Staff members kept track of this aggressive behavior, and when they looked closer at the behavior in the context of the resident's history, it became evident that he was anxious so that there would be no food left. When he was allowed to go to the dining room before everyone else, the behavior stopped. So here, they used the step of identifying what the behavior was, pushing others, which would be an aggressive behavior, and they creative problem solved. They thought, how might this person actually be feeling? And it was determined that he was anxious that there would be no food for him. So when he was allowed to go first, having ample amount of food for him to choose from, the behavior stopped. I call this creative problem solving because these mechanisms may not work for every situation or every patient. It does take a little bit of trial and error to see what works best. But these are strategies that can help reduce or redirect agitation. The first is creating a calm environment. Remove stressors. This may involve moving your loved one to a safer or quieter place, or offering a security object, rest, or privacy. Try soothing rituals and limiting caffeine use. It's important to follow set routines. Try using art, music, or other activities to help engage your loved one and divert attention away from their anxiety. But it's important to simplify tasks. As I mentioned earlier, the world is now confusing and they can no longer do the things they used to as well. So it's important to make sure that what you engage them in is more simple. For example, if your loved one likes to cook, but now it's too hard, perhaps they can help you with one part of the recipe instead of the whole thing. Perhaps they can mix the batter or stir something instead. It's also important to give your loved one some room to respect his or her personal space. If your loved one is having an episode of agitation or anger, this can be very upsetting, so it's important to take a break. If your loved one is in a safe environment and you are able, walk away and take a moment for yourself. This can be helpful to calm yourself down as well as to calm your loved one down. Provide an opportunity for exercise. Go for a walk, garden together. Try to redirect them in an activity they enjoy if they are upset. If they are yelling, and they like to do puzzles, perhaps try to see if they would like to engage in that activity when they are getting upset. It's important to provide reassurance in a soft voice. Say things like, "You're safe here," or "I'm sorry that you are upset." And it's so important that you do not raise your voice or show alarm or offense or corner, crowd, restrain, argue with your loved one. Take care not to make any sudden movements out of their view, because these behaviors will likely worsen agitation and they may perceive this as a threat. And lastly, and this is so important, it's important to focus on feelings and not the facts. Rather than focusing on their specific behavior like getting angry or upset, consider the emotions behind the actions. Now, I mentioned following a set routine. After your loved one is diagnosed with FTD, you'll probably hear us explain the importance of keeping them engaged mentally, physically, and socially. Here is an example of a routine of activities, and yours could certainly look different. I want to reiterate how important it is, especially in light of the coronavirus, that your loved one is not just sitting around watching TV all day, as this can increase behavioral challenges such as restlessness, which can lead to agitation. Try to keep them involved in as many activities as possible. And the third step, addressing underlying causes. To prevent or reduce agitation, make sure to monitor your loved one's personal comfort. Check for pain, hunger, thirst, constipation, full bladder, fatigue, infections, and skin irritation, as all of these things can offset agitation because they are uncomfortable. Urinary tract infections are a common reason for an acute behavior change in those with neurodegenerative conditions like FTD or Alzheimer's disease. And symptoms of a urinary tract infection include an acute change of behavior, urinary frequency, burning with urination, foul smelling urine, blood in the urine, and stomach and low back pain. If you suspect a urinary tract infection, please contact your loved one's primary care physician right away. And now I want to review some red flags. So when do you need more help? When do you need to reach out to your loved one's neurologist or primary care physician? Again, if you notice a sudden change in behavior or mental status, if you find yourself thinking, "My husband or wife just doesn't seem like themselves," there's usually something else going on, such as a suspected infection or pain. And if you think that your loved one may have a skin infection or a urinary tract infection, constipation, it's important that you contact their primary care provider. If your loved one recently changed their medication and you are concerned about side effects, this is when you would reach out to the prescribing provider to see if perhaps the medication can be changed or reduced. I want to reiterate, if you ever find yourself considering the possibility of an emergency, such as a stroke, don't wait to contact their neurologist or primary care physician. Call 911 right away and trust your instincts. Another red flag would be any safety concerns. Is your loved one driving when clearly it's not safe? Are they wandering, hitting, kicking? Are they putting themselves, you, or others at risk? If this is the case, again, this would be a time you'd want to call their provider and discuss what your options are to keep everyone safe. And lastly, are you distressed? Caregiving can be very taxing, and it is important to know when you need additional reinforcements. Is your loved one still getting angry and upset despite trying these interventions discussed today? If so, this may be a time when we would introduce medication, and it's important to follow up with your loved one's neurologist. If you answer yes to any of these red flags, you may need to work with a multidisciplinary team of providers to come up with an appropriate treatment or intervention. And lastly, I want to remind you that you are not alone and have many sources of support. I cannot stress the importance of getting yourself involved in a network of support, which could include a support group run by the Alzheimer's Association or the Association for Frontotemporal Degeneration. I highly recommend looking at both of these websites for more information about neurodegenerative diseases and where to find more support for yourself as well as your loved one with FTD. I know that I go to these websites all of the time to look for helpful resources for caregivers that get in touch with me who need help. Thank you very much for listening, and I hope you and your loved one stay well during this difficult time. Thank you.